Good afternoon, everybody. Thank you so much for coming. Welcome. My name is Dr. Ahmed. I'm one of the LSU family medicine residents here at Lake Charles Memorial Hospital. I am a second year. I'm extremely interested when it comes to preventative care, and some of the concepts that I focus on are particularly about immunization. So I'm so glad that I can talk to all of you guys about this today. Just to get a good idea of my audience here, how many of you guys are below the age of 50? All right. Wonderful. So there's quite, sorry?
How do we transfer to your department?
Oh, well, that's something that's going to have to go through administration.
Better already.
All right. So it's going to be a long presentation. There's a few different vaccinations that I want to talk about, but they are recommended for less than the age of 50. So I'm probably just going to skip over those ones and kind of focus on what my audience is about. And then we'll just save all the questions to the end, and I'll still be around and we can talk a little bit more about it afterwards. Okay? All right. So I'm going to get started here. There. All right. So I have a little video that I'd like to show you. Oh. Does it not work? The internet here. Do we not have internet?
I don't know if Sally maybe had a video.
I did. I emailed her. Okay. It's okay. We can skip over that. All right. So some of the things that we're going to end up talking about today, I'm going to touch base on titers. I'm going to talk about what vaccines are indicated for adults, some of them being our routine vaccinations and some of them being other vaccinations that we may need just in case we were to ever go travel or we have to take care of somebody younger than us that may have certain conditions or certain illnesses. And I'm going to try to touch base upon just the Medicare coverage for certain vaccinations. I'm from Canada, so we work completely differently. So this was even teaching me what insurance coverage could be for certain vaccinations. So we'll touch base on that. Okay, so what are titers? So when we're talking about vaccines or immunity to any diseases, titers identify the amount of antibodies there are in a person's blood. So antibodies are proteins that can be found circulating through our bodies. It is their job to find and remove potential pathogens that can infect us. So they're important because you could have been exposed to it at a certain point in your a certain point in your lifetime, not shown symptoms, and actually developed an immunity against it without even knowing. This can be the case for some of the vaccine-preventable diseases such as chickenpox or measles. When this happens, vaccination is actually unnecessary because your body is already immune to it and already protected. One thing to remember is that immunity is not always permanent. So that's why we get these titers checked to make sure that we are immune to certain diseases and illnesses. And if not, we may need to get certain vaccinations. If you're, just like I said, if your titers show that you are currently immune, you may need to be retested again in the future to ensure that you have retained that immunity, especially if we get diagnosed with any sort of chronic illnesses in the future.
Well, how did you tell if you're immune without, then you don't have to take a shot?
So that's what titer testing is about. Okay, but we'll save the questions towards the end because I do have a lot of things to go through and maybe we'll be able to answer some of your guys' questions through the presentation. Okay, should we be checking titers? Okay, so vaccines work very well. So you would typically not need to routinely check and confirm that you're immune after being vaccinated. Some vaccine titer tests don't always work that well, and titer testing isn't always available for all vaccinations. Testing can be expensive, so we kind of take a look at what our chronic conditions are, who we're taking care of, and then we make a decision based on that. Okay, so how often should you do vaccine titer testing? Sorry, there's a typo on my slide. So for pregnancy, rubella titers only, we'll check those. Anyone who's entering the healthcare force or industry, we check for hepatitis B. I'll jump towards and talk about children and adults exposed in an outbreak. So measles, chickenpox, mumps, but only if you're unsure if you were previously vaccinated and protected. After a needle stick injury, confirm immunity to hepatitis B, and any babies that are born to mothers with hepatitis B.
Ma'am, can I ask you, I must have missed something.
Sure, sir.
What actually is the titer?
So titers are actually antibodies that are in your system that tell us that you're actually protected against a certain virus, a certain illness. Correct. Yes, sir. Okay. So in our case, like evaluation of adults with immune system problems to help identify what they may have. So we check titers again at that time also. Okay, so I'll jump into some of the vaccinations. Like I said, I'll skip over some of the vaccines that are not targeted within my audience. So let's go ahead and talk about the flu. Okay, everybody needs to get the flu vaccine. Please, please, please. We vaccinate during the months of October to March. There's multiple vaccine products available, and the CDC actually doesn't recommend one vaccine over the other. Oh, my picture's oncoming. Okay. All right, these are some of our options. So we have the inactivated flu shot, intradermal, needleless, high dose, and then the live nasal flu vaccine. They all have a certain age group that we can give them to. And our doctor offices might have certain vaccinations over the others. So it's really important to talk to your doctor about what they have available in their clinic. Okay, so our live attenuated vaccines, these contain the weakened live virus. Okay, these are recommended for healthy patients and those for 2 to 49 years old, which not my population right now. So some of the contraindications for that would be if you have an anaphylactic allergy to egg, some other chronic medical problems, asthma, wheezing, and of course, age 50 and older right here. So we wouldn't give these to any of you guys. Okay, so inactivated influenza virus. This is indicated for age 6 months to 64 years, depending on the specific vaccine available at your doctor's office. Also recommended for long-term care facility residents, pregnancy, if there's any contraindication to those, get it for the live vaccine, and any chronic medical problems. One thing I did want to touch base on that I actually did not put in my slideshow, so the flu zone is currently recommended for ages 65 and older. It's actually a high dose vaccine. It's 4 times stronger than your usual regular inactivated vaccine. It's given to elderly to protect you guys and give you guys a better immune response and therefore better protection from the flu, okay? And Medicare Part B does cover for a flu shot every year. All right, the next one I'm just gonna go into is our tetanus, diphtheria, and pertussis. So a little bit about pertussis. It's an epidemic that occurs periodically. In the US, there are certain years that you'll have a surge of pertussis, and that's why we make sure that everybody does get their Tdap booster. And that was instituted in 2006 to make sure that it was part of the guidelines. So all adults 19 years and older need a one-time Tdap booster. Adults should receive Tdap dose if the dose is recommended and no previous record of administration exists. And follow-up boosters of tetanus is recommended every 10 years. Age 65 years and older, do we vaccinate? Yes, please. So if you don't know when your last tetanus booster was, please go speak to your doctor and see if you guys qualify for that and vaccinate. All right, so these contraindications are actually pretty wide range within all vaccinations. Severe allergic reaction or an anaphylaxis, throat swelling up, closing up, not being able to breathe, those would be the contraindications for these type of vaccines. Encephalopathy not attributed to any other cause within 7 days of a previous dose of these vaccines.
If you forgot you had one vaccine and get it again, does it hurt to be vaccinated twice for the same thing?
So are you talking about Tdap in particular or overall?
Overall.
So if you go to your doctor's office and they've already have a record of the fact that you have had that vaccine given to you, you wouldn't get another dose of it unless you haven't gotten it over 10 years.
I go to Walgreens and I thought they were notified
Okay,
behind my doctor, but they're not.
but they're not.
So then I've forgotten what's all.
So if you already have immunity built up towards that vaccine, it is very vaccine dependent. I would have to look into that in a little bit more detail. But if you already have immunity to that, then it shouldn't hurt you. Okay, but all right. Okay, so just a few other points here. If you previously did not receive Tdap or you're greater than 11 years old, you do the 1-dose Tdap and then a booster every 10 years. If you previously have never received the vaccination, that's when you would start off with the full 3 doses. And then every single pregnant woman needs to get a dose of Tdap during each pregnancy, preferably in the early part, weeks 27 to 36 weeks. Okay. And it's okay to give Tdap to patients who are immunosuppressed, breastfeeding, or have latex allergy that is not anaphylactically induced. All right, hepatitis A. So there's an inactivated hepatitis A vaccine. Children are routinely vaccinated, and adults who have not been previously vaccinated should be considered. These are some indications for patients that would want to get the hepatitis A. So anyone requesting the vaccination, clotting factor disorders, chronic liver diseases, drug users, occupational exposure, travel to endemic areas, and certain sexual preferences. Okay, once again, contraindication, anaphylaxis. This slide will come up pretty often when it comes to different vaccinations. Pretty similar, unless there's something that stands out to me or is different, I'll point it out. Hepatitis B. Okay, so this has been in the news quite a bit when we talk about hepatitis B, and that's because it can actually lead to multiple different comorbidities, one of them being like cirrhosis, hepatocellular carcinoma, so we want to make sure we can prevent that. Incubation period is 6 weeks to 6 months. So if you were to get this disease, you might not even know you have it. 50% of cases are only symptomatic. It is caused by blood and bloody fluid transmission, self-limiting, or it can lead to a chronic disease. And 2 out of 6% of adults actually develop chronic disease. And then 15 to 25% of those adults will develop cirrhosis or hepatocellular carcinoma. It's either through blood or body fluid transmission. All right, so it's few vast indications. So more than one sexual partner in the previous 6 months, anyone who's been treated at a sexually transmitted illness clinic, sexual preferences, IV drug use, immunocompromised, also including HIV patients, household needle sharing or sexual contact of those patients that have known hepatitis B. Healthcare, public safety workers, residents, or staff of facilities for disabled people, end-stage renal disease, anyone who's on dialysis, chronic liver disease, anyone who's really requesting the hepatitis B vaccine, and people that might travel to international areas that may have a higher prevalence of hepatitis B. So a couple things about this. Medicare Part B covers hepatitis B vaccine for medium and high-risk patients, but only 80% of Medicare allowable cost of the vaccine, which may not be charged at the cost of vaccine. So it depends on what your copay is to see whether or not it's completely covered, and it could be just partially covered as well. So some of the Medicare-defined medium risks are your healthcare workers, staff working in institutions for mentally disabled patients. Medicare-defined high risk would be your end-stage renal disease, hemophilias, IV drug users, household contact of hepatitis B carriers, and the list goes on. So I don't necessarily want to go into detail about the different vaccines because your doctor should know all of this, and you can just go in being like, I need to get the hepatitis B vaccine, and they'll be able to give the ones that are recommended. But I did want to point out the fact that if you're greater than 20 years old, you need a total of 3 doses of the Hep B vaccine. And if you're on dialysis greater than 20 years old, you get double the dosage, and you get a total of 4 doses. Now, at the end of your doses, you might get your titers checked, and you'll see if you're developed an immunity or have developed antibodies towards the hepatitis B. If it's inadequate, 1 to 2 months after you receive the vaccine, we can give you a booster shot. And this is very important when it comes to patients who have some chronic disorders to be evaluated for there, or something that's affecting our immune system. There's also another vaccine actually that covers both hepatitis A, hepatitis B. So if you haven't gotten both of those vaccines, you can actually just get it, both of them in one vaccination.
That's only 1 dose?
That's 3-dose series, 0, 1, and 6 months, yeah. Once again, our contraindications. I just want to touch base on post-exposure management. So if you've been exposed to a needle stick injury and you're concerned about having hepatitis B and you get your titers checked, but you remember that you actually did complete the vaccination series, but your titers show that you're not immune to it, we'll give you a dose of the hepatitis B vaccine. If you've been partially vaccinated, let's say like you got the vaccine once or twice, but you don't remember if you finished everything, then you'll go ahead and we'll give you the hepatitis B immunoglobulins, which is a protein that will inject to you to protect you from developing the disease, but will also complete your series of hepatitis B vaccine. And those who are not vaccinated, once again, we'll give you the protein to protect you from getting the virus and then start the entire series. Okay. So MMR comes in, it's very important, especially if you're like a grandparent and you haven't gotten vaccinated and your kid, like there's a newborn in the family. So just a little bit about measles. It can cause symptoms which include fever, cough, runny nose, red watery eyes, followed by a rash that covers the entire body. It can lead to ear infections, diarrhea, and pneumonia, and rarely it can cause brain injury. Mumps also, fever, headache, muscle aches, tiredness, loss of appetite. It can lead to its own complications like deafness, swelling of the brain and or spinal cord, and the list goes on. And then there's rubella, which is also known as German measles. So it's a 3-component vaccine. It's measles, mumps, and rubella. Individual vaccines are no longer available. Contraindications to MMR are pregnancy and immunosuppression, including AIDS. Question time. Oh no, it's not showing up. Sorry, yes.
I wasn't listening. How many doses of hepatitis C should you have?
I haven't touched base on hepatitis C. I was talking about hepatitis B.
You said 3 doses for B, right?
For B, correct.
What about A?
For A, I believe it was, I'd have to double check here. I don't think I wrote, I think it's from Dr. Null, it's just one dose.
Does Medicare Part B cover MMR?
I was not able to find much information when it came about the MMR. So certain medication vaccinations I was able to find information on, and then some of them were just not even listed on the list. Yeah. Okay, so just gonna go on a little bit. Okay. So I wish I could just, is there any way to bring it up? No? Okay, that's okay. Yes, sir. Yes, sir.
Oh, okay.
Hi.
You can barely see over you.
Sorry.
That's all right, I have the same problem. I forgot
It's okay. I'll come back to questions towards the end of it, or go ahead.
the virus, shingles.
Sorry.
Shingles.
I'll get to that in just a moment.
Oh, yeah.
We'll be talking about that. Okay? All right.
I have a question.
Yes, sir.
I think I was reading recently where there's some kind of test you can take that will tell if you're a candidate for measles, mumps, 3 or 4 other things. You know anything about
So that's when you get, you mean when you get your titers tested to see, do you mean when you get your titers tested to see if you are immune to those viruses?
Yeah, it's like 4 or 5 things, and you had one test to tell you if you may have a chance of being a candidate to get one of those things. Chickenpox.
Sorry, give me a second. So titer testing was what I was speaking about. So titer testing is what I was talking about earlier, which tells us whether or not you've been immune or you've received a certain vaccination. So that's what I was talking about initially in the beginning of my presentation, is there are certain conditions that we would test you for your titers to see if you've developed antibodies against those viruses. And if you have, great, we don't need to give you the vaccination. But if you haven't, we would need you to give those vaccination.
Would I just schedule an appointment at your office to
Whoever your primary care doctor is, if you were to go see them and tell them, I don't remember ever getting the MMR virus or the hepatitis B virus, I want to be considered to be tested for titers. Now, mind me that it's not always, sorry? Okay, that's okay. Thank you. Yes, if you were to go into your doctor's office, tell them that I don't remember if I ever got the hepatitis B vaccine. Can we either, if you're from Louisiana, we can actually pull up your list to see if you've gotten those vaccinations, and we can go ahead and test you for your titers. But remember that insurance might not always cover that, and it could be expensive. So there are certain indications that they may cover, and then certain indications that they may not cover. Okay, I can just move on. So most adults born before 1957 are actually considered immune. So if you remember this TV, you're probably immune to rubella. So that's because you were infected naturally with viruses, with the virus through the measles outbreak. You check your titers once again to confirm. If you're not immune to it, you go ahead and vaccinate, okay? Immunity is established if you've had one documented MMR vaccination after the age of 12 months or 1 year, or if you're born after 1957, 12 months, 1 year if you were born after 1957, or if you're born prior to 1957 and you've got titers to prove that. Immunity is not established if you can't find it, if your titers are unequivocal or equivocal, and if MMR vaccine was given prior to age of 12 months. Okay, so I don't have any women of childbearing age, but if there were, we wouldn't give the vaccine. We would give the vaccination and ask the woman to wait 4 weeks before getting pregnant. But during pregnancy, it is contraindicated. All right, sir. Now we'll go ahead. Oh, this is chickenpox. We'll get to Zoster in just a second. So many of us have probably already had the chickenpox when we were younger. So this vaccination came out a little later on. Very contagious, can cause blister-like rash, itchiness, tiredness, and fever. It used to be very common in the United States, and each year it caused about 4 million cases, about 10,000 hospitalizations, and almost about 150 deaths. So we're immune to varicella if you were born before 1966, you had a confirmed infection between 66 and 97, you received the vaccine, if you've had a history of shingles, and you have a varicella titer that has been proven. Okay, so the varicella vaccine is live attenuated. We don't give this with any other, or we can give this with, we can give this with other live vaccines, but it should be separated by 4 weeks. And adults will require 2 doses of this vaccine. So if you've never had chickenpox before, and you have a newborn in the house, and worried about them getting, and they're not able to get the vaccine yet, go ahead and check if you've been vaccinated or if you need the vaccine. Once again, some contraindications to this, one being pregnancy, of course, and that's that. Okay, safe situations to administer varicella vaccine. Pregnancy of a close or household contact, immunodeficient family member or household contact, asymptomatic or mildly symptomatic HIV infections, if your CD4 count is greater than 200, and any sort of immunodeficiency. Okay, so now we'll go into a little bit more detail about herpes zoster. So 32% of Americans will experience a zoster outbreak during their lifetime. 1 out of 5 patients will get with zoster will get post-herpetic neuralgia. Okay, that's a form of chronic pain after the zoster gets better relieved. Risk increases when you're greater than 50 years old. 50% of people living to the age of 85 will get zoster, and 50% of post-herpetic neuralgia cases occur in adults greater than the age of 85. Women are more likely to have zoster. African Americans are at a lower risk. Inflammatory illnesses will have higher risks. For example, a history of rheumatoid arthritis. And HIV has actually a nine-fold higher risk. So how effective is the zoster vaccine? So in adults 60 years or older, it reduces incidence of shingles by 51%, and it reduces the post-herpetic neuralgia by 67%. Most effective between 60 and 69 years, and vaccine efficacy 64% versus 38% if greater than 70 years old. Okay, so we'll go ahead and talk a little bit about this. I know many of you have multiple questions. So since the virus is present in most people of certain age, the best solution is to prevent zoster eruption to give the vaccine to boost the immune system and to keep the virus dormant, since we all did get chickenpox at one point. That's obviously accomplished by using vaccinations. Up until recently, the zoster vaccine on the market was called Zostavax. Okay, so Zostavax was a live virus that was actually made weaker, and that was given to individuals to protect their immune system. It was very effective, but it did have a few drawbacks. And one of the drawbacks were that after the age of 70, it actually, it didn't stop working, it just wasn't as effective. Okay, and another reason was being a live vaccine, it was contraindicated in patients who are immunosuppressant. Okay, so now to protect and cover all of those bases, a new vaccine came out, and that's called Shingles, which is this vaccine right over here. Unlike Zostafax, it is an inactivated vaccine, so it's not alive anymore, it's inactivated. It's very different because they actually contain the killed viruses, and it only contains a part of the varicella zoster virus, which means that like the previous vaccine, it could be used in immunocompromised. And it actually seemed to be more effective in patients greater than 70 years old as well. The new vaccine has very few downsides. It requires 2 doses separated by 2 to 6 months instead of 1 dose like the Zostafax was. And then if you've received the Zostafax at one point before the shingles came out, since it loses its efficacy at the age of 70, you can go ahead and get revaccinated with shingles. So it will protect you if you do that, okay? And because shingles can strike again, those that haven't had the vaccine and have gotten shingles and you're worried about another attack, you can go ahead and get that vaccine. It'll protect you from that. Weird, that's there. All right. Okay, Zostafax is what we just kind of talked about, touched base on. So this one is Shingrix is recommended over the Zostafax. Medicare coverage, all Medicare Part D is required to cover zoster vaccines. Patients' copay may vary according to his or her Part D plan. And I'm not sure about other insurance coverages. Okay. I don't have anyone below the age of 45 here, so we're going to just skip over HPV. And if you guys have questions, you can come and talk to me afterwards, and I'll answer those for you. Okay, so we'll go ahead and talk about the pneumococcal vaccine a little bit. So some indications for this, age 65 and older, everybody's going to get the pneumococcal vaccination. If you're younger and you have any of these comorbidities, then you can perhaps get it beforehand. We'll give you the vaccination before. So 2 vaccination. One is called, one's PCV13 and the other one is PPSV13. It just means the number of strains that it covers. So the 13 recommended for children and adults 2 to 64 years of age with certain health conditions, immunosuppression or no spleen, and for all adults greater than 65 years and older. The 23 protects you against the 23 strains of pneumococcal. All adults age 65 and older, anyone who is a smoker, lung, heart disease, immunosuppression, or missing a spleen. You usually receive this dose 8 weeks after the 13. So you get the smaller number first and you get the bigger number next. And then you repeat at age 65 or later if you got it before the age of 65. And then we allow 5-year intervals between the vaccinations. So once again, we vaccinate once after 5 years, only if you have the following: sickle cell, functional or anatomic, so no spleen, immunosuppressed, chronic renal failure, or nephrotic syndrome, ages 65 or older, and if your first vaccine was given less than 65 years old.
Dr. Ahmed, what are we protecting them against when we're doing this? What disease?
Pneumonia. Yes, we're protecting you guys all from pneumonia. Okay. So this is a really busy slide. This kind of does a good job of explaining what vaccinations and when to give them. So smoker, long-term care facility resident, chronic conditions, you get your 23. If you're immunocompromised, you'll start off at 13. 8 weeks later, you'll get your 23, and 5 years later, you'll get your 23 again. Or if you're at the age of 65, you'll get that. And then if you've had any implants, like cochlear implants or CSF leaks in the past, you'll get your 13 followed by your 23 8 weeks later. Okay, so once again, our contraindications. And then our meningococcal vaccine. So it's a serious illness caused by a type of bacteria called Neisseria meningitis or meningitis. It can lead to meningitis and infections of the blood. It can often occur without warning, and usually it can occur amongst healthy people. And it happens most likely when you're in a group of multiple people, such as like adolescents get it in dorms, or if you're going for pilgrimage and you're amongst quite a bit of people around that area, that's where it could get spread amongst. 12 types, and each type has its own vaccination. So you have your Men-B and your ACWY. Those are the different serotypes, and it'll cover, if you get both of these vaccinations, it will cover you for everything, for all of these serotypes, sorry. Usually it's just all adolescents will get it during a certain age group, but if you haven't gotten it and you're concerned about it, or you're traveling somewhere that has a high incidence of meningococcal, I would definitely go ahead and recommend that.
Could you go back to the previous screen for 1 second?
Sure,
Thank you.
of course. Okay. So once again, like I mentioned, travel in countries with meningococcal disease and those exposed to Neisseria more often, 1 dose, and then revaccinate every 5 years if it remains. And yeah. And then we've got our Haemophilus type B vaccine. It can cause many different kinds of infections. They range from mild ear infections to severe diseases, like bloodstream infections, and these are some examples of what it can possibly cause. Recommended for 19 or older if you have no spleen, 1 dose of Haemophilus influenza if you haven't received it previously, and then those who are getting stem cell transplants as well, 3-dose series. Okay, so that's a summary of our adult vaccines. This can be found on the CDC website, and if you go into your doctor's office, all doctors should have this in their clinic. And they'll be able to talk to you more about what age range and when you should give it, and testing for titers as well if you're concerned about that. Okay, health conditions. So this is the handout I've actually given all of you guys. I can just walk through it with y'all. Pregnant women, Tdap, and influenza. If you're immunosuppressed and have HIV, varicella, MMR, influenza, and pneumococcal. If you have a history of STD, hepatitis B, and if you have any sort of cochlear implants, pneumococcal vaccine. We consider our patient's age range. So Tdap, if you're 19 years or older, 19 years or to the age of 64, we get a 1-time booster. And if you're greater than 65, our vaccination is called Boostrix. Okay. Influenza, all adults. Can't stress that enough. Please get your flu shots. Shingles, all adults, ages 50 and older. HPV, now approved in both men and women up to the age of 45. MMR, 1 dose for people born after the 1957. And pneumococcal, all adults aged 65 and older unless otherwise required or indicated. Certain lifestyle factors, so if you've been born foreignly or in another country and you came here later and you weren't sure if you've received these vaccinations, MMR, varicella, and hepatitis B. Certain sexual preferences, both the hepatitis and not in a long-term mutually monogamous relationship, also your hepatitis. And then if you're an international traveler, varicella, MMR, influenza, your hepatitis, and your meningococcal. And it's really important to maybe, if you're going to a certain country and you don't know what vaccines you want or you need, just come into your doctor's office, see your PCP, and be like, I'm traveling here. Can we see if we need any vaccinations to cover that? And whether your clinic, the doctor's office has it or a travel clinic has it, we can always find ways to make sure you have access to those vaccinations. CDC website will answer that too, correct. If you're a parent or a caregiver of a young child, very important to get Tdap, varicella, MMR, and influenza. No college students here, skip over that. If you're in a nursing home, chronic care facilities, varicella, influenza, Hep B, and meningococcal. And if you work in the healthcare industry, it's really important to make sure you're up to date on your Tdap, varicella, MMR, influenza, and hepatitis B. So just a few summary slides here. Adults over the age of 65, remember influenza, pneumococcal, Zoster, and Tdap. COPD or diabetes will need influenza, pneumococcal, and Zoster vaccine. Okay. Adults with end-stage renal disease need a double strength of the hepatitis B vaccine. And contraindications to live attenuated influenza include immunocompromised, asthma, wheezing, or anaphylaxis to egg. Patient care, so influenza infection has high morbidity and mortality in elderly adults. And since 1/3 of adults will get shingles in their lifetime and 1 out of 5 will get postherpetic neuralgia, Zoster is definitely recommended. So just a summary slide on Medicare from what I was able to find. 1 influenza vaccine per season. Zoster vaccine is under the Part D. Your copay may vary. 1 pneumococcal vaccine per lifetime under Part B, and hepatitis B for medium and high-risk patients under Part B as well.
It doesn't cover that in the new Shingles shot.
I believe it does, but a certain percentage of it, from what I read. Yeah. And these were some of my references. Yes.